So I've been covering before how Gavin Newsom has loved to be fear-mongering about coronavirus and how he wants to completely lock his state down to totally unreasonable levels. I mean, even people who are in favor of lockdowns don't advocate for locking it down this much. And, you know, the fear-mongering is all about how there's going to be this second wave of coronavirus and lots more deaths. And so now he's saying the 35.6% of the state's total COVID cases occurred in the last 2 weeks. Right? Let's see what he tells you and what he doesn't, because what they don't say is always interesting. California Governor Gavin Newsom announced California saw its first daily increase in intensive care hospitalizations during the coronavirus attack. He provided an update on the coronavirus pandemic Monday, delivering a clear message that new cases are increasing and people need to wear their masks. As of Sunday, the state has reported 46,735 cases since mid-March. Okay, well, what is this? That's 2 months? 3 months? Yeah. So, yeah, that's most of the pandemic, isn't it? That's most of the time we've had. I see date on this, June 22nd, 2020. So I didn't grab an old article here. So, yeah, you've got most of the cases in the last 3 months because that's been most of the pandemic. Yeah. But he also said in the past 2 weeks alone, the state has seen 35.6% of cases thus far. Now, let me remind you of something I said back when this started, because he's talking about its first daily increase in intensive care hospitalization. There's a lag in these statistics. If you get coronavirus, SARS-CoV-2, most people are going to be asymptomatic or be very mild, but if you're going to be one that's going to require hospitalizations, the virus has to do its thing for about 2 weeks for that to happen. And it varies, of course, but the fact is that when you're talking about people going into intensive care for hospitalizations, they aren't people who just got the virus. They're people who got the virus a couple of weeks ago. And it's developed to the point where, and remember, it's not the virus doing this, it's your immune system. The immune system goes a little haywire and it uses inflammation to fight the virus, but it goes a little overboard and there's a little too much inflammation there, and that's what causes all these issues. So it's not these new cases that are causing the intensive care increase. It's cases that happened a couple of weeks ago. So he says, those that suggest we're out of the woods, that suggest this somehow is going to disappear, these numbers tell a very, very different and sobering story. We're not out of the first wave. Well, again, what he doesn't tell you is the interesting part. What he's not telling you is that most of these new cases are people in their 20s. And generally the younger 20s, college age, maybe a little older. You know, those are the people going to the beaches and, you know, wanting to go to the bars and everywhere and wanting to go to all the social functions and everything. They're the low risk. They're the ones that very likely are not going to end up in intensive care. But they are going to pass the coronavirus around them and build up an immunity. I mean, I really want to know what the end game is for people like Newsom. What are they considering as being, you know, the thing to do, you know, to get rid of all this? Are we just going to lock down until there's a vaccine? And we get herd immunity that way? You know, is that the plan? Because that could be another year or two. You know, what's that going to do to the economy? And how many people are going to die because they, you know, of all the depression, and they commit suicide, or they're too worried about the future, they lose their jobs, they can't afford food. You know, that's not a very good health issue there, not being able to eat. I don't really get, I would love to hear Gavin Newsom and Roy Cooper and everyone else like that tell me what the end game is. Tell me when it will be okay to end the lockdowns. You know, how do you imagine this happening? Because without herd immunity, all we're doing is hitting the pause button. And whenever you end the lockdown, it's just going to come back. There will be a second wave. So who do you want that second wave to be among? Do you want it to just be a free-for-all, or do you want it to be these younger people who are much more capable of weathering the virus? As long as they don't live or work around any high-risk people, I say let them do their thing. Also, as you see in this next paragraph, the number of people tested in the state has gone up significantly, with a record number of 92,000 tests implemented Sunday and more than 3 million conducted since mid-March. Well, okay, so then how many of these are truly new cases, and how many of them are you just getting because they weren't tested before and now you've tested them now, but they might be completely through with it. Because the way these tests work is they check for the presence of viral RNA. And you have, it's called cellular corpses. When your immune system is done fighting off a virus, there's going to be little pieces of that virus floating around your body, maybe even for months. Because it takes a while for your body will process them through and get rid of them eventually, but it's not a problem. It's just these loose little bits of RNA lying around. It's not actually a part of the virus, and so it can't actually continue to affect you and do bad things. But these tests will pick that up. And so you don't know if that person, just got infected or if they've been infected and gone all the way through it and build up an immunity. You don't know that unless you actually do a blood test and try to grow a culture. So again, that's something else they don't tell you. They're just saying, oh, new tests. That means there's all these people getting it. Well, no, not necessarily. So hospitalizations have gone up 16% in the past 2 weeks. ICU patients are up 1%. And Newsom says, despite an increase in the number of hospitalizations and ICU patients, our hospital capacity remains stable and is much better than where we were months ago. That's good to hear. But keep in mind that people who were hospitalized 2 weeks ago got the virus 4 weeks ago or thereabouts. So, remember that lag, and remember that a lot of these cases are coming from, when Newsom was really putting the screws on everything and locking it down. That's kind of what he doesn't want to mention. Let's see. California Health and Human Services Secretary Dr. Mark Galey notes in some counties seeing more significant increase in cases. The uptick isn't only the result of increased testing, but he doesn't say how he knows that. State is working with 11 counties concerning increases. Newsom reiterated the need for residents to follow the statewide mask order to stop the spike in cases. The whole thing, breathing since droplets 4.5 feet, coughing 6 feet, etc. Yeah. We have the mask order here in North Carolina, too. All right. Newsom ended his Monday press briefing by encouraging residents to listen to their local health directors and follow their community health orders. We are a very resourced state, the government said. We're in a much better position than we have ever been to tackle this pandemic. Mark my words, we're in a much better position across the spectrum than we have been in many, many months. How many times have we heard this? They're locking down, and we're in this great position, but guess what? The numbers are still going up. Whereas, you look in places like Sweden, which never did a lockdown, and they're seeing their numbers drop, and they might be even be on the tail end of it. So, yeah. Social distancing, good idea. Masks, good idea. Lockdowns, not really much, because all you're doing is you're confining people into a closed space with each other, and that's how you really get it going. It's sustained contact that really gets this. If you pass someone in the grocery aisle and they're not wearing a mask and they have coronavirus, there's a chance that you'll get it. Sure. Yeah, you could. But it's not great. Not like if you're constantly with someone for hours a day, and they've got the coronavirus and you're inside with them and you're breathing the same air as them. They keep acting like coronavirus is like just this instant virulent thing that just hops from one person to another like fleas. No, it doesn't work that way. Doesn't work that way. As we reopen, all I ask is that we are more vigilant than we have been, even perhaps than we were a few weeks ago. We need to get out of this first and prepare for a second wave and get through this together and blah, 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 pander, all the sort of things that politicians say. I mean, no matter what, we are going to see more cases happen. But like I say, who is it happening to? Is it happening to people in their early 20s, healthy people who don't live or work around high-risk people? Because I'd say that's a good thing. Let them get immune. Let them help protect the rest of us. And I don't know why none of the politicians, well, I know why the politicians aren't doing it, but what's with the news media? Why are they just letting politicians get away with this? It's just like they are so complicit in everything the politicians want to say, and we just can't get good information from them. Who do we get good information from? Occasionally there's something new published in, the Lancet or the New England Journal of Medicine or something like that, and you can read that and get some more information about it. But you're not going to get it out of the news media. You're just not. Everyone's idea of what coronavirus is just completely screwed up. So, all right, that's it for this video. Thank you for watching. Please hit like, subscribe, and the bell. I am being shadow banned, so make sure if you want updates to my videos that you hit the bell and share it everywhere, because that does more than anything, because my videos aren't showing up in related videos when they're supposed to. Even when people are searching for the exact title of my videos, they're not showing up. So please do what you can and go to donate.blogosity.tv and see what you can do to support the channel. You can send PayPal or cryptocurrency, just however little you can. It's fine. The little bits mount up from enough people. So, and you can become a regular supporter with Patreon and Subscribe Star. So thank you so very much. Until next time, stay strong and be free.